edition of Buncombe Live. I am outside, and let me just say, what a winter. It feels good to be outside today. I'm here in the front of the Buncombe County Department of Health with the Health Director, Gibby Harris.
Good morning.
Thank you for joining me outside today.
Glad to be here.
And we're here, and we really want you to watch this and listen and tell your neighbors what you're going to hear about today, because it is important. We've got a lot of misinformation, and you and I have even talked before about this.
Yes.
A lot of misinformation out there that the Department of Health, it's had some changes and that it's closed. That is not true. Not
true. There have been some changes, but we're definitely not closed.
Yeah, let's talk about, just for a moment with the folks, the changes that have occurred here at the Health Center. The Department of Health. Number one, name change.
Name change.
Yeah.
We are now the Department of Health again. This building was renamed the Health Center back 15 or more years ago when they started providing primary care, because it helped people understand what was in this building.
Right.
We're no longer providing primary care.
Now, what is primary care for folks at home?
Primary care is your medical home. It's where you go to get your physicals when you have illnesses, those sorts of things, for both adults and children.
And is that for uninsured, underinsured?
That was the main focus for the people that we served here.
Right.
Those people who had difficulty accessing regular physicians' offices because of no insurance, no income, or in some cases Medicare and Medicaid.
Right. And so those folks would come here for care.
Absolutely.
And what's happened to that?
Well, on January 4th, we moved that service to Western North Carolina Community Health Services. They have a building located at 257 Biltmore.
Okay.
And the signage is an issue right now, but we're hoping they'll get that fixed soon. And they're providing that service. They were doing primary care before, and they were able to absorb the clients that we saw through this department. So they're providing that service at that site.
Right, and the county is actually contracting with them to do that service.
Absolutely. The county is taking the dollars that we were using here and moved it to the to that site.
Right.
The benefits there are the federal government subsidizes federally qualified health center, which is what this is. And that allows them to see more people for less money than we were able to do here.
Right. And so those services have moved from this location to that location.
Yes.
Services are still being provided. And if you want to know more about that, they can go to our website and there's an explanation of that.
Now, the other thing that moved with it were the dental services that were being provided in the basement here. So that's provided at 257 Biltmore as well.
That's right. So those services have moved. But you guys did not close, because that's not all you did.
Absolutely. Actually, primary care is not a significant part of what most health departments do in North Carolina, or across the country for that matter.
Right.
We're charged with assuring that there's access to service, but not providing it all.
Right.
But there are things that we are charged with providing. We currently provide prenatal care, as well as family planning services. Still at the same level that we did before. Immunizations are able to access them here. All of the other communicable disease issues, the sexually transmitted disease services that we provide, as well as tuberculosis skin testing, treatment, those things. Our breast and cervical cancer program is still here.
We're going to take a trip for just a minute. I want you to stay with me, but we're going to take the folks at home on a little trip to visit the BCEP, or Breast and Cervical Cancer Control Program, that is run out of this location, right up here. We're going to go visit them, and you just sit back and relax and listen as Wanda tells us all about that. It's a really great,
it's a wonderful program for women.
Okay. I'm here in the Buncombe County Department of Health. They've recently had quite a few changes over here. They've had adult primary and children's primary care move out to Winches or Western North Carolina Community Health Clinic, and we'll put some information on the screen for that. But there's a misconception that the Department of Health doesn't do anything anymore, and there's not anything over here. That's not true. There's some great programs still here at the Department of Health. They're working every day. They're working hard. But we want to feature one of them this month. And that's why I'm here in this exam room with, and tell me, you are Wanda Anderson.
Yes, ma'am.
Okay. And you work for and let me make sure I get it right, the Breast and Cervical Cancer Control Program.
Yes, that's right.
Short name BCEP.
Yes.
Okay. A lot of folks, I bet you've never heard of it. When I'm out and about talking to folks, they really don't know about this program, and it's a great program. Just want to ask you a few questions, and then I'm going to let you just go and tell me about it. But the first thing I heard about the program that really got me interested is If you are a woman and you have no insurance, and there's a lot of folks out there now, as you know, that have had insurance their whole life, and now for one reason or another, women are without insurance or have very little insurance. The first thing they're going to not do is take care of themselves. They're going to think about getting those kids care, even their husband's care. They're not going to think about going and getting themselves checked. And that's what this program is really for. Tell me what you would do for let's say me, because I'm in the age bracket here of folks you're looking for. If I come to the health center here and looking for help, what's available for me?
What is available for you with the age range that you're in? You would be available for a mammogram. You would be eligible for a pap smear, a clinical breast exam. You would also be eligible for the Wise Woman program, which is part of BSEP, and that is cardiovascular. That is a cholesterol, a glucose, or a hemoglobin A1C blood test.
Now tell me, so let's say I've got a woman out here, she knows she hasn't been checked for any of that in a long time, or maybe has, and she knows there's some problems, but she doesn't have any insurance. She just calls, and we'll put the number on the screen. She just gives you a call. What's the cost to her?
The cost is free. That is the cost to this lady.
That's the amazing piece of this program. Did you hear that word?
Free.
Free. If you are meeting no insurance and you meet the income guidelines correctly.
That's
but
right.
don't even worry about income guidelines. Just call, because you're going to counsel that person when they call, right?
Yes, I will ask them certain questions to make sure that they qualify, and we will get them set up and get their physical done and get their mammogram, and we will get them taken care of. And the BSEP is an ongoing program, so it's a yearly physical, and you'll be called next year to come back.
Now, see, that is incredible. You pick these women up and start caring for them. Now, tell me what happens, though. Let's say that I come in and I get the pap smear, I get the test, and there's a problem.
There's a problem, you'll come back for a follow-up appointment, and if there is a major problem, then we get you tested for that. And then, God forbid that there is something wrong, we have a very special BSEP Medicaid that we put our ladies on, that they're on for the duration of their treatment, Kathy. And it pays for all their treatments. They don't have to worry about anything except taking care of themselves in this time that they're going through.
And see, that's amazing. I mean, not only could they check you and give you peace of mind to say, oh, you're great, you're healthy. That's a great thing to come in and find out. But let's say I come in and find out I'm not healthy. You don't drop me. You don't say, oh, well, sorry. You continue to take care of that person, and it's free. And this was a great thing that I learned about, that you tested over 3,000 women last year, and you found about 45 who did have some significant problems, but they've all survived because they were tested. They detected, and cervical cancer is a very curable cancer.
It's a very curable cancer, and breast cancer is a very curable cancer too if you catch it in the early stages, and that's why we counsel our women to make sure that they do their self-breast exam monthly. That way they get to know their breasts, because ladies we have lumpy breasts, and and we learn the feel of these lumps when we do the breast exams. And that way, you give us a call. We're going to bring you in here. We're going to get you an appointment and get you tested by a clinician. Get you a mammogram.
There's no excuse.
There's no excuse for the ladies not to come. There's no excuse for the ladies not to pick up that phone and call us and just talk with us.
And let's say that you've been tested last year, and now suddenly you don't have any insurance. You need to be tested yearly.
Yearly, yes, ma'am.
Yearly. So, what's the age range for this program?
We work with ladies 18 to 64.
It's a big range.
It's a big range, yes it is. 40 to 64 is where we concentrate mostly. The 18 to 39 is if they have an abnormality.
Right.
Then we can call them. We'll bring them in and we'll get them a pap smear only, or a breast exam only, and then if they need the mammogram, we send them out with the mammogram.
But, all these details we're talking about, you really don't need to worry about, because you just call you. They just need to call that number, talk to you, and you will tell them, walk them through the income guidelines, walk them through the age thing, and just tell them what they're eligible for.
That's right. And we want the ladies to know that, there's a lot of ladies in your situation now that has lost their job, that has lost their insurance, and don't be upset that you've got to call and ask for help, because that's what we're here for. We want all the ladies that are eligible in this county to have this program, to be in this program, and to utilize this program.
Well, and I tell you, I have insurance right now, but this really made me feel good to know if something were to happen, there's still a program here that I I could come and talk to you guys about.
That's right.
Now tell me about this. I have this bright pink flyer here that says Ladies Night Out. And that is wonderful, but I really don't think people know about it. Tell me, what is Ladies Night Out?
Ladies Night Out is based upon the BCEP Wise Woman Guidelines here at the Health Department. We do Ladies Night Out the first Thursday night of each month.
Okay, first Thursday night of every month.
Every month. The ladies call the number that we're going to put on the screen. We set you up with an appointment, and at Ladies Night Out, they get the free mammogram, they get the free breast exam, they get the free blood work, they get diet and exercise education, they get blood pressure checks. If they need transportation, we provide transportation for them. Childcare, we provide childcare, and they have fasted for their blood work, and we even have a little party for them while they're waiting on their mammogram.
Oh my gosh.
So it's
when
the ladies come to Ladies Night Out, and when the ladies come to the Buncombe County Department of Health, they're treated like queens. They're treated like they don't get treated every day like women should be treated.
That's right, because it is important. Women, we're notorious for taking care of everybody else before us.
That's right.
And that's not smart. We need to take care of ourselves so we can take care of everybody else.
That's right, because we do have to take care of ourselves because our family depends on us.
That's right.
And I'm a grandmother, and I want to be around to see my grandchildren grow up.
Sure.
And I know that all the other ladies in Buncombe County want to be around to see their children grow up and their grandchildren.
And it's easy. Early detection. Like those 45 ladies last year who found problems, early detection, they're fine. That's wonderful.
They're fine. And the ladies that come through our program, they're just overwhelmed when they call and find out what all that we can provide for them. And we're so grateful when they call. And we just want to help every lady in Buncombe County.
That's right. That's eligible. You need to call. Don't worry about the income guidelines. Don't worry about all that. Just call, and you will talk to them and tell them what they're eligible for and how to hook up with this program. Thank you so much.
Thank you for talking to us about our BCEP Wise Woman program today.
Now you are welcome. Stay tuned.
Hey, Dad. I know bird flu is quite rare in humans, but could that change if the virus changes?
Need some answers? Find them at pandemicflu.gov. A message from HHS.
That is a great program. We've tried really hard to get the word out about that because those ladies do such a great
It's
job.
a wonderful program, and all you had to do was listen to Wanda to understand what they accomplish each year and the lives saved by the service that they provide.
That's
So.
right. So please, if you know anybody that needs help, that needs those kind of programs, 250-6006, get out there and get
Absolutely.
those. Now tell me more about what else is here that's still here in this location.
The other main service that's here in this location is WIC, the Women, Infants, and Children Nutrition Program. So we're continuing to provide that service here. Women continue to come in, bring their children, receive the services here. We are looking at the opportunity of providing those services in a couple of other locations in the community to make them more accessible.
Kind of satellite locations.
Satellite locations, but we'll definitely continue to provide that service here in this building.
Right.
So the clinical services are exactly the same as they were before, minus the primary care pieces for women, for adults and children.
Yeah. And really all that has just moved location.
Absolutely. The service is still being provided. It's an integrated program. They have pharmacy and lab and all of those other sorts of things through that service at 257 Biltmore.
Now, we're also going to take a trip to see Sue Ellen Morrison,
Yes.
who runs
Around
immunizations.
Immunizations are probably one of the top successes of public health in this country over the past 15 years. There are some of us still around who remember chickenpox and measles and polio, whooping cough, pertussis, those sorts of things that children experienced on a regular basis when we were young. And those are illnesses that can cause major problems for children up to death, depending on how difficulty they have with that particular infection. We have vaccines for those now, and so it's critical that we continue to keep our children up to date on those vaccines. so that those diseases cannot appear in our communities again.
Right, and I know the folks at home have heard H1N1, get your shot. If you haven't, you've been under a rock somewhere. I mean, that
Exactly.
is one of the most successful campaigns I've ever, nationwide,
And the
ever
good
seen.
news is, if you have been under a rock or in hibernation for the winter, we still have the vaccine here.
That's exactly right. And now immunization also does that. They do flu
Yes.
shots. But they also do, and we're going to talk to Sue Ellen about this, they also do some foreign travel
Yes.
shots and all kinds of stuff, but we'll go now and see
She'll
what
give
she
you the
says.
specifics.
Yeah, she'll give us a tour. Okay, we've taken a trip now. We've come inside the Department of Health, and we've come down here to immunizations, which is still in full force. I'm here with Sue Ellen Morrison, who is and you have a new title that I didn't know about, Disease Control Manager.
That's correct, yes.
Ew, that sounds awful. I'm going to manage the disease. Ew.
Well, we try to prevent them.
That's right, so you don't have to manage them.
That's
You just
right.
prevent them.
That's the best idea.
Yeah, but they're still here. Y'all are still doing a good business down here in immunizations. And the reason we're here is we want folks to know that the Department of Health is still open for business, and you do a lot of work with the entire community, not just people who are uninsured or underinsured. That's a myth that's out there, that you have to have no insurance or little insurance to even come in here, and that's not true.
Oh, no, absolutely not.
No. Tell me what kind of immunizations y'all do.
Well, childhood vaccines is a big thing, particularly right now with back to school. People are thinking about that.
Yeah.
There are going to be letters going home and messages sent home as well. That children that are going into kindergarten and those rising to 6th grade, they have some vaccine requirements. So try to get it now so you don't have a big wait ahead of you.
So people can, if they get that letter from the school and they realize, oh, I don't know, they can come here to get their
They can. They should bring their
immunizations.
child's complete immunization record with them so we know what they've had in the past so we don't have to duplicate things.
You know, do y'all charge for that?
It depends on the childhood vaccine that they're getting. You know,
Okay.
required vaccines there isn't, but there is some vaccines that parents still want to go ahead and vaccinate against. So they can check with the immunization clerks out front to make sure what is chargeable and what isn't.
Okay, but not everything is chargeable.
No.
Some stuff's free.
That's correct.
Free. Did you hear that? Free.
Yes.
So that's good. So that's for kids. Now, one thing that I wanted to make sure, I'm just going to go ahead and ask you now before I forget, kids going off to camp, because we're coming into summer.
Absolutely, yes.
So should kids get an H1N1 shot if they're going off to camp and haven't been vaccinated?
Yes, they should, because they're going to be in a very close setting, so a lot of things spread. Many camps do ask that they have a complete immunization record before they even go to camp, so don't put that off either. Go
Right.
ahead and look and see what the requirements are.
And so if parents have that record and they're not sure if it's complete or not, they can just come here, show you the record, and you guys can fill in the shots that they need.
That's right. That's right. That in college, you know, kids are going to be going
That's
away
right.
to college this fall.
And they shouldn't wait
They
till
shouldn't
they get ready
wait.
to go.
And that's really, you know, a lot of people put things off. All of us do. But if they put it off, they may have longer wait times. So really try to get a jump on this.
Yeah, so just come on in here and get it done. So that's children, infants and children, and then camp age and college age. What else do y'all do here?
Kindergarten, 6th grade. Foreign travel vaccinations. You know, we have a large foreign travel clinic. People can get their immunizations that not many people carry. Private providers often do not carry these specific, like yellow fever and Japanese encephalitis. And we go over travel alerts with them. What's going on in the country that they're going to? Are they going to be going off the beaten path? Is there a malaria risk?
And you guys know this stuff. They don't have to go research it and go, okay, I've got to go and ask for this shot. You can just say, okay, I'm going to Japan. And you'll say, okay, well, then you will need these shots.
Correct.
That is such a service, and that's for anybody.
Yes, it is for anyone. You do need an appointment for that one.
Right.
So we do recommend that people call about 4 to 6 weeks before they depart.
Okay, 4 to 6 weeks before you go. So if they're planning now, they need to come over here and talk to y'all. And sometimes there's no shots required.
That's true. You know, some people forget about the smaller or the more insignificant kind of vaccines that they think that they might not need. Like, you know, but are they up to date? A lot of adults aren't even up to date on their own vaccines, and they kind of forget about it. They think it's a childhood thing. Oh, I don't really need anything. I got all this when I was a kid. But you know, they have booster doses for things like Tdap and a tetanus booster. There's a one-time booster for adults that's called Tdap, and that protects against pertussis. And infants that really do not have that full protection series that they need, the adults, the caregivers, and grandparents really need to be protected, so they can't give that to their loved one. So that little child is not protected.
That's
So
right.
they really need to protect themselves from getting it.
Immunizations are important. Now, here's another one. As I'm getting on a little older, I'm thinking about, I've got kids in college, so I'm still thinking there, but it's for me, I keep hearing about people who are getting shingles.
That's true.
And I've heard there's a vaccine.
There is.
So tell me about that.
It's for anyone 60 and older. It is the shingles Zostavax. We do have that here. It's high demand. A lot of people are looking for that vaccine.
They really are right now. I don't know why suddenly, if I'm just talking to an older crowd or what, but they really are looking for that vaccine.
Well, if you know anyone who's had it, then you don't want it.
Shingles, that is.
Right.
Anybody who's had shingles, they definitely don't.
They don't.
What can the vaccine, so you can, let's clear up. So first, if you're 60 or older, you can come here
Right.
for your shingles vaccine.
Correct.
And if you get the vaccine, they don't always say it prevents shingles, but it makes it a lighter.
It's true. The earlier you get it, if you get it closer to 60, you're going to have a higher what they call efficacy rate, where you're going to be greater protected against shingles. And it will decrease the likelihood that you'll get it, but it will also decrease how bad the flare-up can be. So that's really the big key. If you know anyone who's had shingles, it can be very miserable.
You just don't want it.
No.
No. So I had no idea until we started talking. We've gone from infant to people 60 and older.
Correct.
You guys cover everybody.
We do.
And then travelers of all ages,
That's
anybody who wants to travel.
Yes.
So what else is out there now? I know H1N1. That was one of the most successful immunization campaigns I've ever seen. I mean, I don't know anybody that doesn't know about it. So y'all are still giving those H1N1 vaccines.
You still have it. You know, there's still a risk for it. We have seen, you know, if you look at the charts, it goes up and down and up and down, and we don't know about a continuous wave of this. But we are telling people, at least from reports that we've received from CDC, it's still out there, still circulating. It is the predominant strain of flu that is out there. So you can get protected. If you haven't done it yet, you can still get protected.
And so you still have the shots. People can just come and get those H1N1 shots here, and those are free.
They are.
They are free. And then next year you'll be doing flu again.
Yes.
So you guys are busy. You are still active here.
Yes.
Okay. We'll put the information up on the screen so people can contact you if
Great.
they have any questions. They can just call the number on our website. There's also a bunch of information out there, so if folks want to log on and check that out. Anything else you want folks to know about immunizations or what y'all are doing here?
Just that they're here, and people shouldn't put this off. There's so many things that they can protect themselves against, and
Right.
so that's really the key message is, you know, protect your health, get vaccinated, and do it sooner than later.
Right, and do it now. And don't think that the immunization section of the Department of Health is just for the or underinsured. It's really for
everyone.
everybody out there. If you're a Buncombe County resident, they're here for you. Stay tuned. Again, you do all kinds of stuff down there. That was
That's right.
great.
Yes.
But now, what else do you want us to know that's happening at the Department of Health?
We're continuing to provide all of the other services that we provided before. Many of them are home-based services. Our case management services for women and for children, including Nurse Family Partnership, which is a new one of our programs for first-time moms. An excellent program that follows them for up to 3 years and helps them through learning how to be a parent and to be successful.
A confident mom.
Exactly.
Yeah.
So we are continuing to provide those services. School health continues to be one of the programs that we provide.
I don't think people realize that Department of Health does school health.
Yes, all of the nurses in the schools are staffed through this department, including the school-based health centers that we're continuing to provide right now.
Right.
We also work in the community with lots of coalitions on issues like obesity, chronic disease, trying to help make sure that there's good, healthy food available to everybody, that people have access to ways to be physically active, all the things we know we need to have in place for our community to be the healthiest that it can be.
And also, you guys stand ready for any kind of health outbreaks, any
Exactly.
kind of foodborne illnesses or communicable disease kind of things. You guys are here and ready always.
Always. We are charged by the state to be responsible for those types of outbreaks in our community, and we address them as they come up. So we have to be
Always
flexible, nimble, and light on our feet.
Well, and up to date on
address
what's
this.
happening.
Absolutely.
Always. So really partnership with the CDC there and knowing how to do that.
And we also
trained.
work with emergency management here in the county and others to make those sorts of things happen. The hospital is a great partner.
Yeah.
Lots of people.
Health inspections, restaurant inspections.
Environmental services, is our environmental health staff are what keep you safe when you go out to eat on Friday night.
That's right.
They continue to screen all of the restaurants. We're also very engaged right now in making sure that our restaurants and bars are smoke free.
Yes.
Yes. That has been wonderful. We've had great response. Both from the community, who are really happy that this has happened, but our businesses are working with us well.
They are, and I haven't heard any negative about it, and I think that's a positive, just to say that there haven't been any negatives. Any negatives, and that's another thing that y'all are doing. They're doing all kinds of things. The more you talk, the more you realize, wow, y'all are very busy.
Public health is involved in all of those issues. Our main effort is to keep this community as healthy as it can be.
And I know you're doing a community health assessment.
We're involved in our assessment. We do one every 4 years. We've just gotten started. Some people will have someone show up at their door to do a survey. We hope that they'll take the time to do that. It's not very long, but it gives us information about our community that we can then use to plan the services that we need to make available. So we're doing that in all areas of the county because we're wanting to get a really good snapshot of what our community looks like.
Right, and if anybody at home has any questions about that, about the breast cancer, immunizations, anything we've talked about today, you can go to our website, buncombecounty.org, and all the information is there.
Absolutely.
Or they can call.
We love to have the community involved in what we're doing. That makes it more pertinent to our community, but it also makes it richer, and we're doing a better job that way. So anyone who wants to be involved in the work that we're doing, we would welcome.
Yeah, please, your comments, questions, whatever, just give us a call. Thank you, Gibby.
Absolutely, I appreciate the opportunity to talk to you.
You're busy here, and we'll check in with you not too long from now, see how y'all are doing.
Great.
Okay,
Thank you.
Thank you. Stay tuned. What a great segment we had. I just love the county. I love the folks that work for the county. They're all so dedicated to what they do, and you can't find it any better than here at the Department of Health. In going back over some of the things that we talked about, there were a few things that they wanted me to just emphasize, take a second here at the end of the program to emphasize to you at home. The BSEP program, the Breast and Cervical Cancer Program, Wanda just wanted me, she said, Kathy, just please tell the ladies to call the number. Just don't even tell them to worry about finances, just tell them to call me, because if you're diagnosed with breast cancer, it's too late, they can't help you. But if you can get into that program before you're diagnosed and they were to find a problem, it's taken care of. The money is there to help you, so please call them if you have any question. And mark your calendar for the first Thursday night of every month. That's when they do the Ladies Night Out program. Give Wanda a call at that number, and she just says, we can just help spread the word to women that might be able to take advantage of it. And then in talking with Sue Ellen, she said, make sure that folks know we also do tuberculosis skin testing. Lots of people need that. Don't worry about that. Just come here and let them take care of you. They can do those tests for you. She also said, make sure that they know we also do HIV and STD testing for free here. So there's no excuse not to be tested. If you're worried, put your mind at ease and call here and come in and get tested. They're also very aware of communicable diseases, and these folks here at the Health Center are always on the watch for that and keeping you safe there at home. One last thing I wanted to add is we have here in Buncombe County, a new prescription drug card. If you haven't heard about it, you can pick one of those up, any county office, any county branch library, and in your pharmacy. That prescription drug card could save you between 35% and 75% on your prescriptions. You can even try using it if you have insurance. It may help you on some of the prescriptions, but definitely get that card. I think it will help a lot of people because this is a hard time to have to pay for drugs, and we want you to get that card. If you don't have one and are just confused about where to get one, call the number on your screen and we can make sure that we can get one to you. So I hope you've enjoyed this segment. Make sure you stay tuned next month when we're going to talk about some get out and pick it up. It's a great day today, and we hope there's great weather in store for us. We're going to get out and clean up this county. We're going to tell you how you can help us. So tune in next month too to Buncombe Live.